Good morning. Bonjour à toutes et à tous. So we're going to turn to slide 2. We are using data and models to guide our decisions. These models help us gain an understanding of where we are in the epidemic and where we might be heading. While models are imperfect, they do allow us to forecast infection and illness rates in the short term and explore the effectiveness of combinations of public health measures for controlling the epidemic. Models are highly sensitive to our actions. Data and models can help Canadians see how our individual and collective efforts, including staying home when possible, maintaining physical distancing, self-isolation, quarantine, and preventing the importation of infection, can determine the trajectory of Canada's COVID-19 epidemic. Models, especially at the provincial and local level, can help inform health system preparedness.
Bonjour. Diapositive 2. Nous utilisons
Dr. New, good morning. We're using data and models to guide our decisions. These models help us to gain an understanding of where we are in the epidemic and where we might be heading. While models are imperfect, they do allow us to forecast infection and illness rates in the short term and explore the effectiveness of combinations of public health measures for controlling the epidemic. Data and models can help Canadians see how our individual and collective efforts are important for containing COVID-19 in Canada, especially when it comes to the measures such as staying home, physical distancing, self-isolation, quarantine, and preventing the importation of the infection from other places.
This slide illustrates a very important concept. Our objective is to control the epidemic by reducing onward transmission through public health actions to push that blue curve down, while we build up healthcare capacity at the same time to push that dotted red line up. What we want to do is to keep the blue curve below that red line in order to reduce the overall total impact of this epidemic as fast as possible.
Diapositive 3.
Dr. New, slide 3. This slide illustrates a very important concept. Our objective is to control the epidemic by reducing onward transmission through public health measures to push the blue curve down, while we build up healthcare capacity at the same time to push the dotted red line up. What we want to do is to keep the blue curve below the red line.
So how do we make sure that epidemic dies out? Before strong public health measures were put in place in Canada, we estimated that each individual passed on the virus to just over 2 additional people. We have since taken a series of critical public health actions with testing and isolation of cases, contact tracing and quarantine, and Canadians are practicing physical distancing. These actions are helping to reduce the average number of people each case infects by breaking the chains of transmission to the point where each infected individual is transmitting the virus to less than 1 individual on average. The epidemic will die out.
Diapositive 4.
Dr. New, slide 4. Before public health measures were put in place in Canada, we estimated that each individual passed the virus on to just over 2 additional people. Since we have taken a series of critical public health actions, we have put in place a series of public health measures that are essential to achieve our objective of containing the epidemic. For example, testing and isolation of cases, contact tracing, and quarantine, including raising public awareness. These measures together are essential to break the transmission chain.
So, slide 5. In the next few slides, we're going to have a look at where we are with this pandemic in Canada right now. Next slide, slide 6. So this slide shows a snapshot of the epidemiology as it stands, and it is always evolving. So the number of cases or the case rates are different across Canada, and they are constantly evolving. The epidemiologic picture shows that there are regional differences, certainly with the bulk of cases in 4 provinces, British Columbia, Alberta, Ontario, and Quebec. All provinces and territories, though, are affected, with the exception of Nunavut, that has not yet reported a case. So we are also tracking severe outcomes, including deaths in long-term care facilities. We should note that these numbers are based on laboratory confirmed cases, but we know that it paints an incomplete picture, as many more cases are not formally detected or reported.
Diapositive 5.
Dr. New, slide 5. We're now going to look at epidemiology and the pandemic in Canada today. Slide 6. The epidemiological picture in Canada continues to show that there are regional differences, with the bulk of cases in 4 provinces: British Columbia, Alberta, Ontario, and Quebec. However, all provinces and territories, with the exception of Nunavut, are reporting cases. These figures are based on laboratory figures, and we know that it paints an incomplete picture because many more cases are not formally reported. We also have a high level of death in long-term care facilities that we are tracking.
So slide 7. The impact of the virus is local. Canada's cumulative case curve, which is in the black solid line, is an aggregate of a series of regional epidemics. Many factors, such as differences in the timing and pattern of community spread, for example, the timing of March break, or changes in laboratory testing, and the introduction of different public health measures on slightly different timelines, can lead to regional differences.
Diapositive 7.
Dr. New, slide 7. Here we can see that the impact of the virus is local. These differences in timing and pattern of community spread can be due to matters such as the timing of March break, and the different public health measures on slightly different timelines can lead to regional differences.
This slide compares how fast the epidemic is growing in a range of countries. For comparison purposes, each of the countries' curves are aligned to day 0, the day the country reached 500 cases. Canada's epidemic, which is the red curve, is in earlier stages. The line is shorter than others. There are then a series of straight dotted lines, which some of you may be able to make out, which speaks to the slope, and therefore the speed of the increase in cases. Canada's total case count have been increasing more slowly than most countries. We can see the number of cases are doubling every 3 to 5 days, which is comparatively a positive trajectory. Part of this is due to the learning we have taken from the experience of others and the approaches they have taken. This has allowed Canada to act earlier to control the epidemic.
Diapositive 8.
Dr. New, slide 8. This slide compares how fast the epidemic is growing in a variety of countries. We can see a constant accumulation and changes as countries put in place measures, reflecting the trajectory in each country. It's important to look at the dotted line, which shows the speed at which the cases increase. We can see in Canada that the number of cases is doubling every 3 to 5 days, which is a comparatively positive trajectory. The total number of cases in Canada has increased more slowly than in many other countries. This is in part due to the learning that we have drawn from the experience of others and the approaches taken. This has allowed Canada to act earlier to control the epidemic.
I just want to add on this slide that the Canada's line is not a straight line upwards. As you can see, it's beginning to bend a little bit, which means that the growth rate is slowing down a little bit. So in the next series of slides, we're looking at our modeling scenarios. Slide 10. It's important to recognize that models are not a crystal ball and cannot predict what will happen. Models help us understand what could happen under various scenarios to allow us to prepare for the worst case and drive public health action to enable the best possible outcome. Models are used in public health to support decision-making on public health measures and to ready the healthcare system to plan for an expected number of COVID-19 patients. Nationally, we are using two modeling approaches, forecasting and dynamic models. In forecasting models, we use actual data on the cases we have seen in Canada to estimate how many new cases we may expect in the coming week. Dynamic models allow for a longer-term view using our knowledge, which is evolving, of how the virus behaves. It helps us look at different scenarios and the impact of public health measures taken over time. It is certainly important to recognize that all models have limitations.
Diapositive 9. Maintenant, on va regarder
Dr.
les
New,
scénarios
slide
de
9.
modélisation.
We're now going to look at modeling scenarios.
Diapositive 10.
Slide 10.
Il faut bien comprendre que les modèles
It is
ne
important to
constituent
recognize
pas une boule de
that
cristal
models are not a
et ne
crystal
permettent
ball
pas de prédire
and
ce qui se
cannot predict
passera.
what will happen.
Les modèles fournissent des prévisions de
Models
ce qui
provide
pourrait
a
se passer
prediction of what
sous divers
could happen
scénarios.
under various
Ainsi,
scenarios.
ils nous permettent de nous préparer
That allows us to
au
prepare
pire
for
et
the
d'orienter
worst
les
case
mesures de santé
and
publique
to drive
pour
public health
obtenir un
action
meilleur
to enable
résultat
the
possible.
best possible
Les
outcome.
modèles sont utilisés dans le domaine de la santé publique
Models are used in
pour
public
appuyer
health
les
to support
décisions
decision-making on
et pour
public health
préparer le
measures
système de santé
and to ready
en
the
fonction
healthcare
du nombre
system
prévu
to
de
plan
patients
for an
atteints
expected
de la
number of
COVID-19.
COVID-19
À l'échelle
patients.
nationale, nous utilisons
Nationally,
deux approches de
we're using two
modélisation,
modeling
les
approaches,
modèles de prévision et les
forecasting
modèles dynamiques.
and dynamic
Les modèles de
models.
prévision utilisent les
Forecasting
données
models
réelles
use
sur
actual
les cas
data on the
que nous
cases
avons
we have
connus au
seen in
Canada
Canada
afin
to
d'estimer
estimate
le nombre de
how many new
nouveaux cas
cases
auxquels
we
nous
may
pouvons
in
nous
fact
attendre dans la
expect
semaine à
in the
venir.
coming week.
Les modèles dynamiques
Dynamic
qui reposent sur nos
models
connaissances du
allow
comportement
for a
du virus
longer-term
nous
view
permettent
using our
d'avoir une
knowledge of
vision
how the
à
virus
plus long terme
behaves,
et nous aident à examiner différents
helping us to look
scénarios
at different
et l'impact des
scenarios
mesures prises
and
au fil du
impacts
temps.
of measures taken
Il
over
est
time.
important de comprendre que
It's
les modèles
important to
ont des
recognize
limites.
that models have limitations.
So on slide 11. So this is our forecasting model to look at the short-term epidemic trajectory. This slide illustrates three possible trajectories generated by this model, recalling that this kind of model is based on reported Canadian case data. Our forecast predicts that we will see from about 22,580 to about 31,850 cases by April the 16th. Based on the case fatality rate to date, this could mean we reach between 500 and 700 total deaths in Canada by next week.
Diapositive 11.
Dr. New, slide 11. This slide illustrates three possible trajectories generated by a forecasting model. And recall that the forecasting model is based on reported Canadian case data. Our forecast predicts that we will see about 22,580 to about 31,850 cases by April 16th. Based on the case fatality rate to date, this could mean we reach between 500 and 700 total deaths in Canada by next week.
So on slide 12. So this shows the kind of method used by dynamic models. Dynamic models simulate the experience of individual people. So this is a novel virus. All people start as susceptible. Some will be exposed, and those exposed may become infected. These models also include different stages of the disease, from getting exposed, then infected, becoming symptomatic, and then maybe hospitalized, and then the patient recovers. Of course, there's also some serious health outcomes, including death. And modelers will use as much of the scientific information as possible, which changes over time, to populate the parameters for each of these stages of disease. So the consideration of all of these factors produces the modeling scenarios, and the different modeling scenarios produce different outcomes. We can also input measures that reduce the spread of infection, what we call mitigating factors, and others that could increase spread.
Diapositive 12.
Dr. New, slide 12. Dynamic models of scenarios. Dynamic models stimulate the experience of individual people. All people start as susceptible. Some will be exposed, and those exposed may become infected. Models also include the different stages of the disease, from getting exposed, infected, becoming symptomatic, hospitalization, recovery, or death. The consideration of all these factors produces modeling scenarios. Different modeling scenarios produce different outcomes.
So slide 13. So this is an important slide as it applies the kind of measures that we have been putting in place to date to see what happens to the models. So a series of models were synthesized to generate a number of scenarios, including no control, some controls to delay and reduce the peak, and stronger epidemic control measures. So from this, we can discern the range of the population infected, what we call the attack rate, and the potential duration of the epidemic. So stronger epidemic control models that you see at the bottom here on the green box, in the green box, these stronger epidemic control models include a high degree of physical distancing, a high proportion of cases identified, and a high proportion of contacts traced and quarantined.
Diapositive 13.
Dr. New, slide 13. This is a very important slide, as it applies the measures that we have been putting in place to date. A series of models were synthesized to generate a number of scenarios, including no control, some controls to delay and reduce the peak, and stronger epidemic control. From this, we can discern the range of the population infected and the potential duration of the epidemic.
Slide 14. This slide illustrates the three possible scenarios that we just talked about. The red curve with a very high peak over a relatively short period of time is the no control scenario, or the worst case scenario, where the majority of the population could be infected. The blue line shows a scenario with weaker controls, leading to the delay and reduction in the peak. The green, smaller curve is the best case scenario in which we reach our objective of epidemic control. So this is the scenario we're working towards, where each infected person only transmits to less than one person. We can stay on this green curve by achieving high and sustained degree of physical distancing, and at the same time a high rate of case detection and self-isolation and contact tracing and quarantine.
Diapositive 14.
Dr. New, slide 14. This slide illustrates the three possible scenarios we just talked about. The red curve with a high peak over a relatively short period of time is the no control. The blue line shows a scenario with weaker controls to delay and reduce the peak, and the green curve is the best case scenario, which is we reach our objective of epidemic control. In this scenario, we're working towards a situation where each infected person only transmits to less than one other person.
La maîtrise de l'épidémie n'est possible qu'avec un degré élevé et soutenu.
We can stay on this green curve only by achieving a high and sustained degree of physical distancing and at the same time a high rate of case detection and self-isolation.
Slide 15. This slide shows the cumulative severe outcomes, critical illness resulting in death, for the 3 different scenarios. So in the green bars, that is the green small curve, that is the epidemic control scenario. The blue bars show the weaker controls, and the red bars show what happens when you have no control. And at the x-axis, you have the percentage of the population infected, and on the y-axis, the number of deaths. So these stock numbers tell us that we must do everything that we can now to remain in that best case scenario, to stay in the lower range of the green zone with strong epidemic control. Our collective efforts, despite all the hardships and the costs, is critical, as we must minimize the population infected, that's on the x-axis, in order to keep deaths, ICU admissions, and hospitalizations as low as possible. The resolve and the level of efforts of all Canadians, from our healthcare workers on the front line to public health authorities, to all Canadians who are practicing physical distancing, will ultimately determine whether we can remain in this best case scenario and ensure that our health system can cope. We cannot prevent every death, but we must prevent every death that we can.
Diapositive 15.
Dr. New, slide 15. This slide shows the cumulative severe outcomes, critical illness resulting in death, for the 3 scenarios in the previous slides.
Les barres noires, aucune mesure de contrôle n'est mise en place.
Bars in black show no measures put in place.
Qui retardent et réduisent le pic, ce sont les barres bleues.
The bars in blue and the best case scenario are in green.
Notre objectif est de rester sur la voie des meilleurs scénarios possibles.
Our objective is to remain on the best case scenario line in order to reduce the number of deaths.
Malgré les difficultés et les coûts qu'ils représentent, doivent minimiser le
We
nombre
must
de personnes qui
minimize
sont infectées
the number
et
of
aussi
people who are
hospitalisées.
affected and
Ceci gardera
hospitalized.
les décès au plus bas
This will
possible.
keep
La
deaths as low as
détermination et
possible.
le niveau
The
d'effort
resolve
de
and level of
l'ensemble des
effort
Canadiens,
of all
de nos
Canadians,
travailleurs de la
from our
santé en
healthcare
premier
workers on
lieu,
the front
aux
line
autorités de
to
santé
public
publique,
health
en
authorities,
passant par tous ceux qui pratiquent l'éloignement physique, déterminera si, au bout de
show
compte, nous
that
pouvons rester dans ce
if we
meilleur
practice
scénario.
physical distancing, we will be able to remain in this best case scenario. We cannot prevent every death, but we must prevent every death we can.
So slide 16. This shows our collective ambition across Canada, which is to achieve epidemic control, to not only minimize the cases and the severity of impacts, but to minimize the duration of that first wave. I just want to emphasize that even once we're past the peak of this first wave and on the downward trend on the other side of the curve, it will be equally critical to keep up with our control measures. If we let up, new chains of transmission will take off in our highly susceptible population, and the epidemic will reignite. If we are to not lose our hard-won progress, we must stay the course until we have reached a very low number of cases at the bottom of that first wave. However, even with epidemic control, we anticipate that some public health measures will need to remain in place to prevent the growth of future smaller waves.
Diapositive 16.
Dr. New, slide 16.
Le scénario qui représente le meilleur cas de maîtrise de l'épidémie peut réduire la gravité à la
Our
durée de
collective ambition
l'épidémie.
is to
Et c'est
achieve
ce que nous
epidemic
visons.
control.
Il est essentiel
It
de
is
maîtriser
essential
rapidement
to quickly
l'épidémie pendant cette première vague.
control the
Toutefois,
epidemic during
même
this
avec une
first
maîtrise de
wave.
l'épidémie,
However, even
nous
with
prévoyons
these
qu'il
measures
faudra
in
que
place,
certaines mesures de santé publique
we expect
devront
that some
rester en
public
place
health measures
pour
will have to
prévenir la
remain
croissance
in place
de
to
petites
prevent
vagues à venir, de plus petites vagues à venir. Si nous
future
ne voulons pas
waves.
perdre les
If we
progrès
don't want to
réalisés, il faut
lose
garder la carte
our hard-won
jusqu'à ce
progress, we
que
will
nous
have to stay the
atteignions
course
de très petits
until
nombres
we
de
have
cas.
reached a very low
Même
number
une fois
of
que nous
cases.
aurons passé le pic de l'épidémie et que nous sommes
Once
sur
we
la
have
pente descendante
past the peak of the first wave and are on the downward trending side of the curve, it will be equally critical to keep up our control measures. If we do let up, new transmission chains will take off in our highly susceptible population, and the epidemic will reignite.
So on slide 17, so what do we need to do now to determine our future? Next slide, slide 18. So to keep on that green curve, we have to continue to implement the public health measures we have put in place. We have to keep an eye on that trajectory to see if increased measures are needed so that we can continue to aim for the lowest possible infection rate to both minimize illness and deaths and to shorten the duration of the epidemic. We have to prepare our health system to expand our health system capacity. Recognizing that even if successful, some public health measures need to be sustained to reduce both importation and domestic transmission. The epidemic is not the same in all parts of the country, so the control measures will have to be readjusted depending also on the local epidemic situation. It is too early to know how close we are to the peak from a national perspective. However, we are discussing with all chief medical officers of health what more should be done to keep us on the path of epidemic control. Once we've observed significant progress in getting the epidemic under control, we will still need to have highly sensitive testing in order to alert us to any new cases occurring so that we can trace and stamp out any chains of transmission quickly.
Diapositive 17.
Dr. New, slide 17. What does our strategy look like? Slide 18. We are continuing to implement the measures we have put in place, and we are keeping an eye on the trajectory to see if increased measures are required so that we can continue to aim for the lowest possible infection rate and to shorten the duration of the epidemic. Recognizing that even if successful, some public health measures need to be sustained to reduce both importation and domestic transmission. The epidemic is not the same in all parts of the country. As a result, when control measures can be readjusted, decisions will be based on the local epidemic situation. Some regions may be able to relax some measures, while other areas of Canada cannot. It is still too early to know how close we are to the peak from a national perspective. However, we are discussing with all medical health officers what measures should be taken to keep us on the path of epidemic control. Once we've observed significant progress in getting the epidemic under control, we will still need to have highly sensitive testing, and that will be in order to alert us to new cases occurring so that we can trace and stamp out any changes of transmission quickly. We will be back in the coming weeks to provide an update on our progress as the impact of our measures becomes more evident.
Slide 19. So in conclusion, while some of the numbers released today may seem stark, Canada's modelling demonstrates that the country still has an opportunity to control the epidemic and save lives. We cannot prevent every death, but we must prevent all the deaths that we can. We all play a role in what the future will hold for Canada's COVID-19 trajectory. We must continue to control the epidemic using tried and true public health measures, including asking every Canadian to stay at home whenever possible, maintain physical distancing, meticulous hand washing, and cover our coughs. What we do together now to stop the spread of COVID-19 will reduce the impact of the epidemic and determine how soon we can readjust our public health measures. What we do together now will buy us more time to further understand the virus and to develop treatments and vaccines. We are the authors of our fate. Together, we can plank the epidemic curve.
Diapositive 19.
Dr. New, slide 19. While some of the numbers released today may seem stark, Canada's modelling demonstrates that the country still has an opportunity to control the epidemic and save lives. We cannot prevent every death, but we must prevent all deaths we can. We all play a role in what the future will hold for Canada's COVID-19 trajectory. We must continue to control the epidemic using tried-and-true public health measures, such as asking every Canadian to stay at home, wherever possible, to maintain physical distancing, to meticulously wash their hands, and to cover their coughs. What we do together now to stop the spread of COVID-19 will reduce the impact of the pandemic and determine just how soon we can readjust our public health measures to a new normal. What we do now will buy us more time to further understand the virus and to develop treatments and vaccines. We are the authors of our fate. Together, we can plank the epidemic curve.
Thank you, doctors. We will